Good morning, Bob. Time for Health Bits. What do we got going on today?
You know, you and I are both big fans of hospice and the great services they provide.
Because they've helped us in the past.
Yes, they have. Yeah, you and I have engaged with them.
We've needed them in many different ways.
And we have such a great organization with Napa Valley Hospice here. They do a great job. Well, a couple of years ago, they identified, you have to qualify to be on hospice. It's not something you just call one day and say, hey, I want to be on hospice. Not that anybody is going to want to volunteer to do that.
Right.
But you have to qualify. Well, what Napa Valley Hospice and Adult Day Service identified a couple of years ago, there were people who weren't qualifying that also needed resources to help them in their homes. They created this program called Transitions, which is all about palliative care. And I brought the lady that runs the program, the boss.
This is the boss lady?
Yeah.
You look like a boss lady.
I'm my boss lady.
You're the boss of you?
I'm the boss of me.
Well,
Yes.
good morning, Angela. Boss of you.
Good morning.
Yes. So Angela started this program a couple of years ago, and the reason why she hasn't been on the program yet is because they told me to keep it on the QT.
Oh, really?
Yeah. Finally, she's decided to show up and come out
of the light.
Coming
out of the dark.
Coming out of the dark into the light.
You're an angel.
Into the light.
You're the white-feathered angel.
So now that you've come out into the light,
Yes.
tell us what you do.
With the Transitions program, one of the reasons we wanted to keep it under wraps at first was to be able to make sure that we could just grow slowly and provide the services that we wanted to. So we wanted a slow growth. So what we do is it's a palliative care program, which is for people who maybe headed towards hospice but aren't quite at that point yet. Medicare has very specific guidelines that say this makes someone appropriate for hospice. And those have also gotten tighter in the last couple of years. So if someone isn't appropriate for hospice, but they still are heading towards end of life, so they need a lot of support around pain and symptom management, around what resources are available in the community to help them, a lot of emotional support, just being with people on this journey and supporting them as we can. And so with the Transitions program, what's interesting about it is that it looks different with every person because every person has different needs. So it's definitely not a cookie cutter program where here's what we do. It's based on what people need around either physical symptoms or emotional support or community resources and just finding out how we can plug in with them in any way and support them.
Statistics says, Bob, that if you reach the age of 80, there's a good chance you're going to have 3 chronic problems with your body.
My back's going to hurt.
Well, we know that today.
Oh,
and you're not even 80.
Yeah.
No, I'm
That's
just
one.
saying, I know I get one right.
And association with those chronic conditions usually result in pain on some level. I know you live with back issues, but when you get older, dealing with pain every day is harder.
The older we get.
So
Yeah.
one of the things Angela does, she goes in and helps people kind of manage through that from her perspective.
Exactly. Just the different symptoms, whether it be pain or restlessness or insomnia, hard time sleeping, just a whole variety of depression, being really tired, being fatigued. People have a really hard time with that. So just trying to help them troubleshoot those things, either through medication or through other ways of what
Chair
can they
dancing.
do. Chair dancing.
I've seen this going down, Bob.
Yes.
They chair dance at the hospice.
It wasn't me.
One of the things, because I focus on the aging population, is there an age requirement to go on Transitions?
There's no age requirement. It's for people of any age. And the piece that we're looking at is people who are headed towards hospice at some point, maybe within the next year or less, but just aren't there yet. Either they're still pursuing treatment, they still want to go in and out of the hospital, if whatever it may be. If they get dehydrated or have pneumonia or some sort of health issue, they still want to be able to go to the hospital versus hospice where they stay home and just stay comfortable there in their home. So people are still wanting to be more aggressive in care, but are headed towards that end of life. Those are the people that we're looking at serving and working with.
So I know you're an RN.
I am.
So you have that medical side,
Yes.
but you also do lots of social work
Yes.
kinds of things. So do you have some social work background as well, or is it just...
It's been a great learning curve the last 2 years, and we do have social workers in our agency who support me. Sometimes they go out and will see patients depending on what the needs are. There's 2 of us nurses. There's 2 nurses now that are seeing patients with Transitions, myself and Lori, and we both had a little bit of knowledge around social work and in terms of what social workers do, I should say, support wise. And then it's been a big learning curve, and it's been great. I've learned so much about the different resources in the community, insurance, Medicare, Medi-Cal, supporting people with all of those things, IHSS, in-home support services, caregiving needs, just everything.
And I know neither one of us are trained in counseling per se, but we do it every day.
Exactly.
Because, what I have found with counseling, a lot of times, it's really just being a good listener. Isn't that what you find?
Absolutely. It's so true. And I think a couple of things that people that I work with that say, number one is they so appreciate the value of having someone that they can call, having a nurse that they can call.
Right.
just to talk to, to say, is this concerning? Is this not? But also just to have someone who's there listening. And that's one of the things with the transitions program that's important to us, is that we do have the time to sit and listen, because, the doctors are so busy. And so they have their appointments and they do what they can do, but they don't have the time to sit and listen for an hour and talk with someone over something. That's, more of a rarity for them, because they have a lot going on too. And one of our goals is to be able to sit and help people process and understand and answer their questions.
How do I get you? I mean, how do I get you to come to my house and be a counselor, be a social worker, be a pain management?
Yeah. Anybody can just call our program, and what we do is, so a referral can come from any source. So if somebody's interested in finding out more about it, they can call us. Should I give my phone number?
Yeah, of course.
Okay, our number is 254-4161. It's the Transitions Program phone number. And what we'll do is talk about what's going on and see if you're appropriate for the program. If so, then we just contact the doctor and make sure that they're on board with it as well.
So does it take a doctor's written authorization like hospice does?
It's different than hospice, because we're not a licensed program in terms of we don't do hands-on care. So we don't do blood draws or wound care or those kind of hands-on nursing care. It's more, it's in verbal and support and helping with resources. So we don't require a doctor's order, but we want to make sure we're working with the physicians. So we check in with them and say, do you agree this is a good next step?
Yeah, because unlike hospice, you still have the primary doctor still involved in the care.
Right. Well, hospice does too. Hospice, the primary doctor is still their doctor. But with transitions, it is different. The doctors still are more involved with hospice. They do tend to, hospice becomes more of the primary. That's probably what you mean, yeah.
That's what I mean.
The doctor stays either way. But yes, they're a physician with transitions. People still usually will go see their doctor and are interacting with them more so than with hospice.
So people that are listening can just call the number and say, I'd like to have you come see us. Mm-hmm. And so the first thought is, well, what's this going to cost me? There's no cost associated with this.
Well, we recently did have a cost. We recently added a cost. We have a sliding scale. So the cost is $60 a month, but we have a sliding scale. The thing is with our monthly fee is that if people can afford that, that's great. If people can't afford that, we don't want that to be a deterrent to them coming on to the program. So we have a sliding scale. We don't check any financials. It's just, this is the fee. If you can't afford this, tell us what you can afford, and that's fine, because we really want.
So it's more about donation is how I would look at it.
In a way,
They're not going to turn anybody away.
Oh,
exactly.
We both know that.
See, we know this for a fact. If you can't afford it, you make it work. And
exactly.
if you can, you help out a little more, but no one gets turned away.
Right.
Absolutely not.
Right.
Because we want to help people. And what the reason we added, one of the main reasons we added a fee, is because there's a lot that's changed in the hospice industry. And hospice things have been really coming down a lot tighter around regulations. And so it was important to have each of our programs look separate. And so having a free program in the hospice realm puts up like red flag kind of thing.
It didn't work, yeah.
Yeah, so, it's a separate entity. It's a separate program.
Did I tell you? I bring lots of great resources to you.
As always, Bob, angels, you bring them in one by one.
Absolutely.
And now you brought the boss angel.
Yeah, exactly.
It just happens to be Angela.
It just happens to be Angela, right?
Isn't that crazy?
Look, Angel Boss Angela. Huh?
Oh, I like that.
Is that my nickname? He's
Stunt Bob.
Stunt Bob, and I'm Angel Boss Angela.
Angel Boss Angela.
Yeah,
I like
they
it.
like this. See, there you go.
It.
Winner. Thanks,
so
Bob.
It was great having you, Angela.
Thank you.
Thanks
for
coming,
having me.
Thanks
I'm
for
glad to be
finally
here.
coming into the light so we can brag about you.
Yes.
And showing off your white feathers.
Oh, there you go. I'll have to put them away now that we're leaving.
We'll see you in a couple weeks.
Oh, yes, you will. Thanks, Bob. Thanks, Angela.
Thank you.